Hey team, it's your nurse educator Amy here, and welcome to part 7 of my video series on ventilator basics for nurses. In this video, I'm going to be discussing APRV, also known as bivent. This is an advanced mode of ventilation that is really ideal for truly lung-sick patients, as this mode of ventilation maximizes the amount of time that the lungs are open while minimizing the time that they are not. This mode of ventilation is centered around 4 specific settings on the ventilator. We have our pressure high, our pressure low, time high, and time low. Now there's no set respiratory rate in this mode of ventilation, but as you can see here, these 4 settings kind of make up a respiratory rate of some sorts. The time high is and the pressure high kind of signify an inspiration for the patient, whereas the time low and the pressure low kind of signify an exhalation phase for the patient. But it is important to remember that in this mode, the patient can still spontaneously breathe. And you'll know that they're doing that by these little waves at the top during your time high. If the patient is not spontaneously breathing, you'll see that the top of the wave is flat. So again, the little waves mean that the patient is spontaneously breathing, and a flat line means they are not. Okay? Now, a huge thing that you need to keep in mind with this is that because we're maximizing the time of inflation of the lungs while minimizing the time that they're deflated, that's going to mean that the patient is at a really high risk for CO2 retention. And we all know the more CO2 that is in the patient's blood, the more acidotic that they can become. So because of this, it's going to be really important that we are monitoring the CO2 levels of the patient at all times while they are in this mode of ventilation. Now, one reason why it's really great that the patient can spontaneously breathe in this mode is because while they're doing that, it does allow for more passive expiration of the CO2. So in this mode, we really want to be careful about over-sedating these patients, and it's very controversial about whether or not the patients can be paralyzed in this mode of ventilation. You may know that really lung-sick patients often get paralyzed so that they're not fighting the ventilator. A good thing about this mode of ventilation is that because they can spontaneously breathe, it's oftentimes more comfortable for the patient to spontaneously breathe, so it allows the ventilator to do what it's supposed to do. But just keep that in mind and make sure that you're in close communication with your RT and provider about your sedation level in your patient and the expectations and how that relates to the CO2 and oxygen levels of your patient. So again, big things to remember about APRV or bivent in your patient is that it's really going to maximize the amount of oxygen that your patient is going to receive, but we really need to be watching that CO2 level. So your patient may be on a continuous CO2 monitor, and or we may be doing frequent ABGs to monitor those levels in the blood. Be sure to stay tuned for our last part in this video series. I'll see you in the next video.